Excited to have him here. He spent the morning with us. For those of you, the residents don't know this, a number of the faculty, myself, Dr. Toole and Dr. Spitzina, spent a lot of time with him today because one of his many areas that he's demonstrated both leadership and excellence in is faculty development. So we're working with Dr. Cooper to kind of help develop a faculty development plan, anyway, it's a little redundant, but so for those of the residents to know that what faculty development means is really helping your teachers teach better, helping the faculty do research, helping us be better clinicians. So it's kind of rounding us out as faculty. So we are lifelong learners as faculty. And Dr. Cooper, I'll just give a little introduction. He started his educational career at Transylvania University in Lexington, Kentucky. Went to Vanderbilt Medical School, and then went over to Cincinnati Children's, where he was both did his residency and then did chief residency. Came back to Vanderbilt, did a fellowship in general academic pediatrics called the Robert Wood Johnson Clinical Scholars Program, which has a very high, has produced some of the most outstanding general pediatric researchers in the country. In that program, he did MPH. And since then, he's been at Vanderbilt for now over 20 years on that stage. And he's risen up through the ranks. He's done a lot of very important research that you may or may not be aware of. Some of his later research has been on, well, he's kind of an expert on big database analysis. And one of the most memorable papers I remember from him is kind of dissecting this issue of being on a stimulant and is that a risk factor for having a cardiovascular event? And as you know, there's a black box warning on stimulants. So he did an analysis published in the New England Journal in 2011 that really showed that there was no increased risk for children on stimulants for having that. And that kind of spoke to his passion, which he has told us about today, which is looking at the inadvertent effects of policy on children. And they put that black box warning based on a study and really didn't have the evidence to do that. And there's been, as a result of that, there was also a black box warning on SSRIs, on suicide in adolescents. And that led to a tremendous decline in use of SSRIs for depression, and actually an increase in suicides as a result. So there was some inadvertent, and he did a study looking at the risk of suicide in adolescents on SSRIs. So he's very well versed, but his most recent role has been in developing faculty development programs in the Department of Pediatrics, not only for pediatrics, but also for the College of Medicine at Vanderbilt. And he also directs a center called Center for Patient and Professional Advocacy that is actually consulting around the country to help with faculty development and patient safety. So I'm really honored to have him come here today, and I look forward to your remarks. Thanks. Let's welcome him, Dr. Cooper.
Well, it's great to be here. I have an appreciation for ETSU that stems back to I need to do something different here for this feedback. That really stems from my research as a fellow. So I was doing drug safety research, and we needed to find out a little bit about what was happening with adverse outcomes by coming out and reviewing medical records. And so several of your faculty here helped me make connections to come. So I brought my kids. I was a fellow, then had young kids. They swam in the pool all day while I sat in the medical records department getting nauseous watching microfilm go by. So a long track record of kindness here from folks. I really appreciate that. We're going to talk today a little bit about designing and developing your career. And so if you're a resident, this still is important to you because it's an important thing about sort of mapping out what it is you want to be when you grow up. So I'm 53 and I'm still waiting to grow up. I'm looking forward to that day coming. So you never get to the point where you're done developing, but there's certainly points along your career where these things to begin to be important. Just to sort of get a feeling, residents, raise your hand. Okay, so you all over here eating your taters, that's good. And I think the students are on break this week, so no students. Are there other students of any other things? What do you study? Fourth year. Well, we're glad you're here. And all the student questions go to this young gentleman over here, so that's really good. And then we have faculty. Faculty, raise your hand. Assistant professors. associate professors, full professors. Excellent. Anybody that has not raised your hand yet? Excellent. So we've covered everybody. So when you think about this, one of the things that we talk about is career development, right? So faculty development, there's all these milestones around development of professionalism. I like to really think more about design. Really designing intentionally what it is that you do and the contributions that you're going to make. Because one of the things that you'll find in your careers, and as you think about people that have been role models for you or other people that you've encountered in your sort of professional development, is that many times we just go through our careers and a really great opportunity comes up and it's this shiny thing coming down the road. So we just grab at that shiny thing. And then another shiny thing comes along, we grab at that, and then we grab another shiny thing. And at the end of our careers, we've got this nice handful of shiny things that have nothing to do with each other. What we find, that creates challenges because in order to keep that shiny thing shiny, you have to put a lot of effort into it. And so if I'm putting effort into a bunch of 4 things or 5 things or 6 things that have nothing to do with each other, then I'm a little more exhausted and I don't have time to do any of them really well. So being intentional about designing your career, we've found is a really important strategy. And so we'll be guided by this notion of the 3 Ds of faculty design or career design and development. And this is sort of casting this vision of what it looks like to have a successful career. So one of the most important things when you're thinking about launching your career is to discern your passion. Really discern and really understand what it is that drives what you do. All right? The second is to determine, well, what path are you going to take in order to pursue that? So as physicians, we have different paths that we can take. We can take a primarily clinical path where we take care of patients and do an awesome job taking care of that, right? What else could we do? What are other sort of paths that we might take? Administrative. So you could do what I do, sit in an office all day. Not kidding, I still see patients and do all sorts of stuff. But you could take on administrative roles, and that can be the way that you move your passion forward. And people that take on leadership and administrative roles often do it because they realize that by making that contribution, they can help other people find their passion. What's another way, what's another path that people can take to advance their careers? Research, advocacy and affecting health policy, and please residents for Dina. Yes, I was going to say, Dina just gave you an awesome lecture on looking at babies with jaundice, and so teaching is a really key thing. So your path towards realizing your passion is going to be a variety of things, and it needs to sometimes align with what's available to you, what you're really interested in, what you find to be fun. And then finally, within that path, define what your contributions are going to be so that you can make a difference. Right? So that we want to come to work every day and love our jobs. So the first thing, let's talk a little bit about, well, what does that mean to discern your passion? Because it seems relatively straightforward, but if I were to just stop and say, well, what is your passion for your career? Sometimes that's not so easy to answer unless you've thought about it. The passion that you develop for your career may arise from a clinical experience you've had. So fourth year, tell me your name. Justin. So Justin, tell me about, so what field, what are you interviewing for right now? What are you going into?
Either peds or family.
Peds or family. So the answer is, I've loved my time on the pediatric service and it's been so important with such effective teachers. I'm still trying to decide. That's how you suck up to the pediatricians. Anyway, so what Justin was saying that. So when you think about what drove you there, was there an important clinical thing that you had when you got on your pediatrics rotation as a third year? Was it something early in your career that drove you that way?
I would say earlier, my mom's an LD nurse.
So your mom's an L&D nurse, so you hung out with babies and moms and families sort of things throughout your career and found, I'm guessing that I'm going to assume that your mother was a positive role model for you and that, yeah. So Justin's mom was a really positive role model. So that arose from people he hung out with. And then when he got on pediatrics and your family medicine rotation, if you're like me, I got on pediatrics like, oh, I'm home. These people are like me and they like the same things I like. So when you think about your passion, it arises from those kinds of things. Also, it could be this sort of central defining point of your career. You might have this really big experience. More often than not, it's a little more organic than that. And it can be a combination of things. Your passion should guide your activities. If you're passionate about something, it should inform what you choose to do. So I always like to think about case studies. Do you recognize any of these cases? We are going to de-identify them later in the presentation and only identify them by their initials. So these may be strangers. So we will be discussing the case of EL, KS, DS, DT, and DW. Okay, so that's setting the framework in those very recent pictures that were taken of these folks on your website. So let's talk about the case of EL. What does Dr. EL's passion arise from? Personal experience. Has anybody worked with Evan before? Do you get that passion when you work with him? You're nodding. What about Evan comes across with that passion for you?
The way that he explains his own personal experiences to patients and how they can set up their own expectations.
Yeah. So Evan's able to really articulate his passion because he says, I've been there. Thank you for that. And it is this notion of then teaching. You may not have seen it, Evan, how many nods I got on this side of the room from people who get that and see that in you. So Evan's a great example of somebody who can really articulate that passion. What did his passion derive from? One is his personal experience. Some were positive, some were negative. Wants to make that better or optimal. And this notion that he can make a difference by teaching you guys how to take really great care of these kids. Right? So that's EL's passion. KS. KS is passionate about maternal and child health. And if you spend 4 minutes talking with her, you see where that passion comes from, right? So who's been in the nursery with KS? Do you get that? And do you get, and I don't mean to compare KS to other nursery attendings, but I bet you get a different kind of tack on the care that you deliver there when KS is there because of the notion of this sort of family care and the advocacy notion. So that's how KS makes a difference through the teaching because it's aligning with her passion. Is that true, KS? That's good. All right. And so the other piece of this is working with underserved populations that's driving KS's passion. DS? Why? Why on earth? Who's been on service with DS when he keeps asking you why? There you go, right? This curiosity for things, and with the recent emergence of neonatal abstinence syndrome, and in his studies early in his career, DS was interested in understanding why things keep happening. Rather than focusing on other aspects, the discovery and the curiosity is what drives that. DT, is it a shock to anyone in this room that Don's passion is teaching? Has anybody picked up on that yet? You get it, right? Well, what does that come from? Right? It's this notion of the educational process. And who's ever had a one-on-one conversation with Dawn where she made a difference for you? Raise your hand. Dawn, this is your early Thanksgiving gift. Raise your hand high. Even Dr. Wood. Those of you who haven't, your homework is within the next 6 weeks to schedule an appointment with Dawn so she can change her life. So, When you ask Dawn, well, what the heck do you mean by the process of education, which I did, she was able to further describe it's actually the process of the person I'm teaching developing into a wonderful person and a wonderful professional. There's great satisfaction that she derives from that relational teaching. Do you get that when you know Dawn and what she brings? That growth and development. You know, describing, so some of you, who are my students who were students here and now you're second or third year residents? Anybody? So Dawn has been particularly pleased to watch your growth from when you came through as a student. I'm assuming you're doing okay, right? Okay. I'm thinking the best of all of you today, that your mothers are reasonably good role models and that you're doing okay because you're still here. So if I missed the mark, I'm clueless and I'm from Nashville. So anyway, assuming you've done okay, what has been awesome for Dawn is that longitudinal watching you from being clueless to really knowing how to do that. And in fact, Dawn said to me, you know what's my favorite thing that happens is in the nursery when one of my third year residents comes back and teaches me something and they're telling me what to do. Don't boss her around that much, doesn't like it that much. But this notion of that educational process coming full circle is really rewarding for Dawn. And then finally, Dr. Wood. That awesome photograph in his office of those kids in Ecuador, isn't that cool? You walk in and you see his passion from the second you look on what's on his walls. And that concept of global health and making a difference in areas of the world that are underserved and advocating for children. And what he's done is wherever he goes, he identifies those underserved populations and using public health research approaches makes a difference to address those inequities. So, this is all about your skills building. I want you to take a second and think about your passion. What it is that you're passionate about and what that comes from. It's something that how you might be able to make a difference. It's something that is exciting for you and something that you might see yourself coming to work every day to pursue. So, let's do a quick experiment. Matt, can we use you? Okay. So, Matt, how would you describe your passion?
I think part of my passion is being able to teach interns and residents and impart some of that behavioral health perspective, mental health and behavioral health perspective to medical residents.
So Matt is what Matt's telling us that he really loves teaching interns and residents and sort of interprofessional teams from watching your practice how to really think about behavioral and mental health issues in the care of their patients. What's that come from?
I think partly from my earlier training of being able to be mentored in an interprofessional team in grad school.
So Matt's experience early on was being mentored in graduate school from interprofessional teams with physicians and psychologists and social workers and others who helped shape your career, right? And was there ever a time where it didn't go as well and you want to make a difference in that? Or is this all driven by that experience?
No, I mean, I think it's being able to, especially in a clinic, see processes maybe that aren't as efficient or don't work as well, and being able to use that team perspective to change those, make them more efficient, and move them forward.
And Matt, would you say you're more I know you do some work in autism, I know you do some work in trauma, I know you do all sorts of things, ADHD. Are there particular things that really get your motor going? Like when you've had a really great day, what kind of day has that been looking like?
I think being able to work with parents around kids with externalizing disorders and being able to bring the team in on impacting that.
So what words did Matt use that stuck out to you? So what he said just now, for those watching by the link, is the notion of kids that have externalizing disorders and working with the family and the child and the whole team to provide the best care. What do you hear there? He said team a bunch of times, didn't he? What else did he say a bunch?
The family.
Family. He really is focused on the family and the child. What else?
Best care.
Best care. He wants to make sure we take the best care we can, and interprofessional. So if we were to describe Matt's passion, to paraphrase, and you'll edit, Matt is really passionate, if I understand correctly, in an area where he can teach in interprofessional settings to really provide the highest quality care for kids, particularly those with externalizing disorders, where we can engage the children, their families, their environment, plus those who take care of them, to really align all that we do to get those kids to have the best outcomes. Does that get close?
That sounds really fancy and good.
Well, it's all your words. We chose your words. The audience picked the words, right? Interprofessional team, externalizing disorders. So that then can describe Matt's passion. I want you to take just a second and think about your passion. Why do you do what you do? I want you to think about why it is. Matt's experience was being on an interprofessional team. Dr. Wood's experience was going to Ecuador. Karen's experience was being in a setting where she was people that did research and were engaged in public health were all around her. Justin's mom inspired him. All right? So think about that. When you think then about your career vision statement, I want to pursue a career where I can fix something. What is it that you want to fix? Optimize the care of kids with externalizing disorders. Address neonatal abstinence syndrome. Train the next generation of leaders. Whatever that is, by using either teaching, clinical care, research, leadership, interprofessional team leadership, okay? So think about that. You're going to have to tell somebody about it in about 30 or 45 seconds. So don't slouch on me, okay? Let's take one of our residents. Who has already decided what you want to be when you grow up? Where's our third-year residents? Any third years here? It's okay. This is very painless. It's a judgment-free zone. Matt's not crying over here. Tell me your name. Rachel.
Hi.
Are you okay if we talk through this with you? Okay. So what are you going to do when you finish your residency?
Neonatology fellowship.
Neonatology fellowship. Why?
I really enjoy all the experiences I've had in ICU, and I think it's just really rewarding to have a patient that's in a very tenuous setting and work towards getting them bigger and getting them home.
And is it the physiology? Is it the disease process? Is it the complexity and like the urgency of the care that appeals to you?
The complexity and the urgency.
So the complexity and the urgency of the care really appeal to you. And this notion of taking a baby who could die, if we don't fix something, fixing it, and then letting them grow up and be bigger and better. That capture it? Okay. So then you might say, my vision comes from my experience during training, where I was exposed to kids who were really sick and saw how we could use our technology and our medicine to make them better. I want to pursue a career that allow me to take care of babies in the neonatal intensive care unit by providing really high quality care and getting training that's going to allow me to do that in the best way possible. Would that capture it for you? So you're done. When you finish now, you can turn to your neighbor and say just what I said. So you see how you fill in the blanks. Does your passion have to be perfect today? Does it have to be the same today as it was 20 years ago? No. It just needs to be what you're about right now, and it's going to frame what you do. So now what I want you to do is take a minute, turn to your neighbor. It should take you 22 seconds to say this. You say yours, they say theirs, and we'll get rolling. Dawn's already done, so it's going to be really fast. For those watching on the video, text somebody you know. For those watching on the video, text somebody you know with your passion. So the second person should be going now. All right, conversation's dying down. Somebody on this side of the room. Who was really impressed by the person you spoke with? All right, so it's a time, may he tattle on you and tell what he heard from you? What was her passion?
Yeah, so she is passionate about seeing other people succeed and helping them get there.
I love that. Who was impressed by one of your colleagues on this side of the room? Oh man, we got a good thing.
Yeah, even though you said my statement could be almost identical to what Travis said. He said that his vision comes from his experiences growing up in Eastern Kentucky and Appalachia in an impoverished area with low resources, and he wants to do a career that will allow him to provide quality care and better health outcomes for the people of Appalachia. So we could have had the exact same state.
Yeah.
Just change Kentucky for Virginia.
Yeah. Thank you, Travis. That's really cool. Does anybody else know that about Travis? Isn't that cool? Dawn, of course, knows it. She's had you in her office, changing your life. And so that's great. So it's not that hard to do if you just think about it and think about why it is that you do what you do. So the second part of your skills building is to vet your passion. Your homework is to share this with somebody else outside the room or somebody who's in the room who you haven't talked to, who you haven't shared it with. Particularly if they're your boss or your mentor or somebody that you really admire that's been a role model for you, your program director, an attending, and just sort of share it and ask them a couple questions. Does this capture what you see in me? You know, Dina, when you have your conversation, do the people see that in you? Because you're a great teacher. I saw you teach. So that's a really great thing that you do. What suggestions? And then ask that person, what did you learn from your experiences when you were at my stage of my career? What did you wish you'd known when you were a third-year resident about to start doing what you're going to do, Travis, or going into your neonatal fellowship? Right? So those are important things to do. So you've got a passion. Everybody got a good concept of your passion. It's something from an important life or clinical experience. It's something that defines kind of why you do what you do. I write my passion down on a Post-it note, and you can be reminded when you're trying to choose between activity A and activity B why it is that you should do A over B. But now let's think about your path. What direction do you want to go to make a difference in your area of passion? And so you think about, oftentimes, you do have to sort of take advantage of opportunities that are put in front of you, right? So it's not that we have the flexibility to go off and just do anything we want to. It turns out we work for employers often who are going to pay us and have expectations that we're going to do something. Nathan can't just suddenly decide that he's focused on vulnerable populations and not show up for work, right? Don't do that, Nathan. I taught you better. So when you think about aligning your passion, so you're going to think about who are the people in your community, your professional community, your community at large that will help support that. What are clinical opportunities that you might take advantage of, the path that you're going to take? What are educational? What are scholarly activities? So when you think about your path, for you all who are going on to your careers, you'll begin to, your next stage of your career will differentiate you further towards your path, and you'll be drawn to do things more narrowly focused in neonatology or in the care of vulnerable populations in underserved areas that'll be driven by that. But in general, these are the bottom things I want you to think through, is that what's the path in your clinical work, in your service to the field, and in the scholarly way that you do your work that supports your passion in the greatest way possible. For example, let's think back to Matt. What's Matt about? Remind me what are the key words that Matt used? Teams. Family. Interprofessional, interdisciplinary. Externalizing kids with mental health disorders. So Matt would not want to take a job in let's say in an inpatient mental health unit that only had psychologists, right? That's not any part of what he's doing. So you're thinking about, even as you choose your job or within your job, choosing what you do to be guided by the path that helps you get there the best. It needs to be the thing you love the most. So and when we think about that path, one of the things I encourage you to do is occasionally pause and ask yourself, what path am I taking? Particularly this is important in your faculty career, but it's also important for what you all are doing. So it's important to say, well, what do I think I'm doing? Am I an educator? Am I a clinical leader? Am I a researcher? And if I'm identifying along that path, does everything I do as much as possible support my success in that area? So if I want to be an educator, but I only take a job in a clinical setting where I just take care of patients all day and there's no learners that ever come to that place, don't take that job. Or if you find one of the things that these kind of talks often will do is create this sudden acute disalignmentosis dissonance. And that is you suddenly are like, oh, crud. I won't cuss because we're taping. So, oh, crud. I'm not doing anything that supports my passion. It's okay. You just kind of move and figure out how, within the constraints of what you've got, how could you do things? Because in a purely clinical setting, you could teach all day long, teaching other coworkers, teaching your patients, teaching your families. It's just how you go about it, right? So, how does the path that you're on relate to your passion? So, Dawn, what path would you describe you're on? You have a passion for relational teaching and making a difference in learners' lives over time. What do you do on a day-to-day basis in addition to your clinical work?
So a lot of one-on-one meetings with residents.
Yeah?
Semi-annual reviews. We're in the season right now, so meet with every one of them.
Excellent, excellent.
And I also do work with students as far as there's a Quillen Trainees in Pediatrics group where I advise the fourth year students going into pediatrics and the pediatric interest group and advise the
Yeah.
Humanism Society.
So there's a lot of things that Dawn's doing that support her passion for this relational teaching, right? So she works with the Quillen Society. She has semi-annual evaluations. Has everybody scheduled your meeting with Dawn? Get on in there. And has an opportunity to do that. Did Dawn say, I work all day long building and designing curricula? No, that's not what she's passionate about. Does Dawn say, I go and I teach in the first year medical student course and I just give lectures all day long and I click slides and do some case-based learning with them? No, that's not what Dawn's passionate about. So Dawn has successfully aligned her path with her passion. Does that make sense? So one of your jobs, your homework item, is to think about what's one thing you might adjust in your day-to-day life that helps you to align even more with what you're doing. So tell me your name. Help her on the back. Tell me your name. Nana? Yeah. So Nana, can you think about one thing that you might do in the next 1 to 12 months to allow you to do what you do, which is you love to help other people be successful?
I'm basically trying to learn about the needs of others, and thanks to all of you, you challenge me every day by submitting different research projects.
Yeah, yeah.
Different therapeutic areas, different settings, and that's interesting for me to learn how we can help you to succeed. Because at the end, your publications is my reward.
So helping to find out where there actually may be connections between something that this person's studying, between this person, and maybe helping to connect them, or bringing that up is a strategy you might use. So it's a thinking about a path to help you be successful, because their success is actually your success, where you get a great deal of satisfaction. Amazing. That's great. Guess what? You got homework. So in those who haven't had your semi-annual review, when you come in to talk to Dawn, you're going to say, here's kind of where I see myself going. You two have it made. You're done. You say, in order to be successful in this path, I'm going to go off and do this neonatology fellowship. And Travis, what are you heading off to do? Gen Peds. Awesome. So you're going to say that. If you've got mentors, advisors, if you have a committee that oversees anything, anytime you've got an interaction, take advantage. So think about this. Do you think, because some of you, right now I hear you say, your junior faculty and residents, you're saying, there's no way that I would ever have the courage to go talk to a senior faculty member and talk about this stuff, because they're really busy. Senior faculty, who considers yourself to be senior faculty? Yeah, some of you are more senior than you think. Not old. I do not mean old. This is not a concept about age. Who considers that you're in a leadership position, or you're an associate program director, or a program director, or you do something? I guarantee you those people would be thrilled for people to come talk to them about these things. It would make their day. Because why are they in an educational setting? They all have a little bit of non in them. Your success is their success. So go talk to them. Catch them in the hall when you're on service with them. Pull them aside when you're in clinic with them. If you're in the pod 1 with them and you've got a nurse and you and the general peds attending with you, or you're in continuity clinic, take a little downtime while they're getting the patients moved back in the afternoon. In fact, have all 4 of you talk to the attending and have a conversation, because this is really important. Now, when they tell you and you talk about this, when you say, am I doing what I need to do? Also then say, what should I do differently? Who's joined the faculty within the last 3 to 5 years? This is really a critical point for you guys to have this type of conversation. Because you've already begun, Nathan, I know we talked earlier today, you've already begun to do some things around your pre-hospital discharge, post-hospital discharge work, thinking about vulnerable kids. It's a good time to take stock and say, well, here's kind of what I'm doing. Here's the path. Do I need any other skills, or is there another thing that I might think about doing as I want to be successful? Got a passion. We got a path. And then we need a set of milestones along that path, which are your series of contributions that you're going to make. Discern your passion, define your path, determine your path, and define your contributions. So we're all about alignment, right? So your contributions that you come to work every day and do should align with your passion. They should align with your path. If you're a researcher who's passionate about asking questions about why, and you're curious about why some babies develop neonatal abstinence syndrome and some babies don't, like DS, what would you do? You would align what you're doing around that thing that you're passionate about, and align your activities through that. Now, you got to be strategic here. Life does not exist in a vacuum where we just get to, some of us, it looks like, some people I know do, it seems like everything just always works out for them. But for me, I just had to take advantage of things that came along. You know, I remember distinctly, I do drug safety research, and I had done some work understanding the effects of medications on children. And this was right around the time of 9/11. And there was a huge federal push for research and a bunch of money thrown around behind research. And they said, if there's a bioterrorism attack, we need to understand what happens if we had to put entire cities on azithromycin. We don't know what happens when pregnant women take azithromycin. Somebody please do a study and we'll give you some money to do that. Well, I did research in drug safety. I done some work in pregnancy. I was pretty early in my career, but I put in a proposal and it got funded. That then started me on a set of steps to do research in pregnancy and drug safety. I wasn't intending, before that came out, I wasn't intending for that to be the primary focus for the next 8 to 12 years of my life, but it was. And it was because it was strategic to draw on that. The other thing that you want to think about is, how do you distinguish yourself? If you're going to make a difference, one of the most important things to do is to think, well, what is the specific area where you might make a difference? So when you think about how do you have a seat at the table? So Karen, we were talking a little bit earlier about your passion and advocacy for breastfeeding through the TIPQC, a statewide quality collaborative. One of the things that is that Karen would have an opportunity to do is, within that community, people throughout the state, from Memphis to here to Knoxville to Nashville to Chattanooga and between, what is it that Karen brings that no one else brings to the table? All right? So she's got the passion for the maternal side, right? She's got an MPH and an understanding of public health and epidemiology. So she might be the epidemiology public health person sitting at the table, because next to her is going to be the person who is very passionate about breastfeeding. And they bring to bear the expertise about breastfeeding. How do you establish breastfeeding? How do you ensure that it's successful? The next person is going to be a neonatologist who's taking care of babies who've really had challenges. The next person, so what you see is that Karen has nicely created a niche, and when she gets to the TIPQC, or she's on the TIPQC conference calls, she's able to articulate and raise issues that only an epidemiologist who has passion for maternal and child health linked can make. Did it play out like that? That's how it works. Yeah. So, yay, it works. Awesome. We did not practice this before, so I'm glad we picked the right example. So, what you want to do is think about how do you create that niche, and then allow yourself to differentiate. But always have a chance to check in on how that's going. Right? Now, what are the types of contributions that you as a faculty member at ETSU can make? There's really 4 things we do in academics. We take care of patients, we teach, we serve the field, and we do what we do in a scholarly and thoughtful way. Faculty. These are activities. Direct a major clinical program. High patient satisfaction scores. Serve on a national committee. Chair or be in an active departmental committee. Engage in QI, or serve on a board or develop questions for board. Does this language look at all familiar to you? What is this language from? Anybody? The promotion criteria for a faculty member in the Department of Pediatrics at ETSU. Right? Is that an accident that we've been talking about alignment all day, building to this point of saying, pick the things that you do that are first you're passionate about, that are on your path, but please be clever and make sure you do a couple of things that help you get promoted. Because it's not about being promoted. That's a milestone along your journey for making a difference for the kids you serve. If you come to work every day and you check the boxes, you will love your job less than if you think about how Evan can make a difference for those kids with diabetes. And how can Evan align his clinical education, service, and scholarly activities around his passion? Because if Evan comes to work every day, loves his job, and does some of these things, because they're going to help him advance his passion, promotion's just something he passes on the way to him loving his work. But if Evan is not strategic, and he just resides in this area of, all I want to do is just that every single patient is a one-off transaction. I'm going to take really good care of this patient today. And I don't do anything else beyond that. Then I take care of the next patient and the next patient. If Evan doesn't act in strategic manner, that's great. He will provide care for a series of patients and will make a difference. But if Evan does things by aligning his educational activities, all those residents who saw in Evan that passion and are going to take better care of your patients with diabetes because of what he taught you, because you know he will haunt you if you don't do it right, that makes a difference. So Evan's already having a ripple effect that, good news, helps your passion, Evan, right? So pick these activities not because you're going to get promoted, because you're going to make a difference. Clinical care. See a bunch of patients, fine. Do something unique. Differentiate yourself, much like Karen's done, as the public health epidemiologist working in the TIP-QC work, the QI work. Teaching. What are teaching activities that we do to support our passion? Do it really well. Be nice to your students. Great strategy to improve. Don't listen, Justin, but the best way to improve your teaching evaluations is to, during the course of the interaction, tell residents and students that you're about to give them feedback every time you give them feedback. Because I give feedback all the time, but if I don't expressly state it, people may not notice. Nathan suffered that when he was a resident at Vanderbilt. I'm about to give you feedback. I just gave you feedback. It's a really important thing. And it's not just to get good teaching evaluations. It's because people need to pause and say, oh, I'm about to get feedback so that I can improve my performance. That's what makes you a good teacher, not so you get good teaching evaluations. Makes sense? See how you make that connection? These are the other standards. What is it that Dawn does in the teaching realm that's really good? Well, apparently she wins every teaching award that's ever created in the history of personkind. She gets really good evaluation. She has mentees who love her, who are very engaged. You can't get more interactive than one-on-one, right? So these are the types of things that Dawn does that make contributions in teaching. And then in the research scholarly area, we know that when you're a busy clinician seeing a bunch of patients, you're not going to spend every day writing papers and getting federal grants. That's not the expectation, unless that's the expectation. If you're doing that, then go do that really well. But we're in an academic setting, all of us are. Let's be scholarly and thoughtful in what we do. So when Matt and Dr. J work on the trauma work, they're informed by the literature. And they don't just sort of grab things out of the air and come up with this really good idea that seems clever, do they? I'm assuming you didn't, right? I'm assuming the best of you both, right? Okay, great. So these are the types of things that are contributions. So what does Evan do? He works with patients with diabetes. He works with the American Diabetes Association. He engages families. Do you see that? How Evan's aligned his contributions? Karen? Works on grants about adverse childhood events, teaches, goes up to the highest corners of the state to work in the rural primary care track, does her clinical care in the birth center, works with the beautiful Children's Resource Center around the corner. See the alignment of her contributions with her path and her passion? How about DS? Publishing papers. Way to go. Takes care of babies within AS. We already talked about Dawn. We'll quit glowing, send our glowing praise. And then Dr. Wood works with kids on transition, does amazing work, just got back from Ecuador a couple weeks ago. Right? What a model. I mean, what a huge model to think through what a difference. A line from a time he spent in Ecuador when he was much younger. Right? Much younger when you went to Ecuador? Yeah. No offense. All right, so what you want to think about then is how do you get your trajectory? So we talked about this 3 to 5 year time horizon. So those faculty in that 3 to 5 year frame, those faculty beyond, when you think about, well, what do I want to do in this next 3 to 5 years? Great news, you too, and others. Your fellowship and what you do right after your fellowship is within that time frame. So you're going to be doing things in your fellowship and early in your career that are predestined by the fellowship program, but think how you might make a difference there. Define your contributions. And finally, when you do this, it makes a difference. These are what our case study cases said. Think about the things that build you up and say yes to those. Things that hold you down and hold you back, don't do it. Don't be afraid to make changes and evolve. Ask the question why. consistently. Say yes to areas that align with your passion and know the other opportunities. This person apparently came to my talk earlier. I'm sorry to repeat it. It's worth investing time to get the training you need to fulfill your dreams. A couple of these people got additional training, did fellowships or other things. And you don't have to go off and spend 3 years to do a fellowship to be expert in, if you're passionate about breastfeeding, what does it take to be a lactation consultant? Or at least get training in that. What does it take to be learned? So that you may not practice in that exact thing, but learning how to do that really well can be really important. Those investments, I've never had anyone say, I really regret the fact that I learned more how to do my job better. I just haven't seen that happen yet. So when you think then about designing your career, I hope that as you pause and you'll do your homework, Don will hold you to that for the residents, and the rest I hope that you'll think about this. But the goal here is to have, when you go home at the end of the day, as few as possible days where you go, what the heck did I just do all day? Because if you can take your activities and know what you're passionate about, do things during that day. So Matt was in clinic this morning precepting a social work graduate student and a psychology grad student. He's doing things that support his passion. So I'm hoping you don't go at the end of the day and say, what the heck did I do besides waste an hour at lunch? And so, that was a joke. So my children say that if I have to tell them it was a joke, it wasn't funny, so I get that. So nonetheless, the whole point here is that if you're intentional about this and really strategic, it can make such a huge difference for your career. Any quick questions? We do have a minute or two left for questions.
So first off, thank you very much. That's a message that I think all of us at every stage in our career need to hear. I recall being in medical school and hearing many times, not focusing on passion, but focusing on your board scores were good enough to get you into this field. You need to pursue that field, or message along those lines. How did you find that the message of passion was received at an academic institution like Vanderbilt?
So the question is, when you talk about passion, isn't that really soft and squishy? Shouldn't you be focusing on board scores or RO1 grants or other things? So the point here is that, yeah, sure, some people may think it's squishy, and that's fine. They just haven't seen the light yet. But what you do is you put it in terms of, if I'm talking to a really research-intensive audience, I'm putting it in terms of their activities that support what they're really interested in. So it's about the notion of creating those things. But I always argue that you got to know why it is you do what you do. And even the most hardcore scientists will be able to describe for you a baby who died in his arms of RSV and why he comes to work every day and makes a difference for RSV vaccine. So people will always be able to pull that together for you. And so as long as you are sort of take advantage of that, I think that's an important thing. To answer your question? Okay. Yes?
It seems like your message would really benefit people very early in their medical career. How do we get the message to first-year medical students, second-year medical students?
I think it's a part of that notion, and I think we have this disconnect between saying, make sure you get really good board scores so you can go into ophtho-dermoplastopathology, the most competitive residency that there is. I think it's just about how could we do that? Probably one student, one really passionate relational teacher at a time, engaging as we think about career development, getting it earlier on. I think you're absolutely right. Okay.
I know you consult with institutions around the country. How well do you think our profession does this?
So the question is, based on our experience around the country, how well does our profession, our profession of physicians, our profession of pediatricians? I would say it seems like common sense. It's not commonly practiced. So I started doing this work because I was chairing our appointments and promotions committee, and people would show up on our table that was like, what the heck have they done? Not that they didn't accomplish things, but it had nothing tied together. So I don't think it's commonly practiced. People within those realms, though, there's people that are wildly successful, But what we're trying to do is move the needle so as many of the rest of us can be successful. I think that's it for time. Any closing thoughts or greetings?
Dr. Cooper,